I'm your host, Jennifer Pulapaka with Podiatry Doc Talk. Regain your health with quick and ingenious tips and chats so you can be stronger and healthier. I'm here, making complex foot and ankle problems sensible and simple. Episode 1. As I read the latest journal article on antibiotic resistance and diabetic ulcers, I realized they failed to ask a difficult question. Imagine a scenario like this. A patient has an appointment for a wound. The medical team sees the patient, puts them on antibiotics, and explains that if there's an open wound, they run a culture and sensitivity test checking for bacteria. They will start the patient on empirical antibiotics, wait for the results, and discontinue if the wound is negative for infection. Now, if asked, does this contribute to antibiotic resistance? The answer is yes. But in a litigious society, the medical team begins to feel as if they have no choice in the matter. And that is the elephant in the room. So that brings up a question. Is antibiotic resistance a real issue? Here are the facts. All chronic wounds contain bacteria. It's the determination between contaminated and colonized versus critically colonized and infected. You see, each wound behaves differently. Evidence-based medicine continues to uphold the fact that superficial wounds under control only need an appropriate moist wound dressing. Even when they're misbehaving, an antimicrobial dressing is ideal. We utilize oral and IV antibiotics when the wound criteria indicate a problem. So a next question. What is the reality of overuse? Well, the FDA has only approved 2 systemic antibiotics in the last 5 years. That's almost a 90% drop-off from the 1980s. Here's a fact. In 2011, Pfizer closed its antibiotic research facility in Connecticut due to financial reasons. And that brought an end to research in gram-negative bacteria like Pseudomonas. And these bacteria demonstrate resistance to numerous drugs and antibiotics. Well, also 3 major pharmaceutical companies, which were Eli Lilly, Adventist, Bristol Myers Squibb, have stopped doing research and development on antibiotics since the 1990s. Recently, the Infectious Disease Society of America wanted to stimulate interest and development into 10 new antibiotics by 2020. To this end, Cubist Pharmaceutical pledged $400 million to antibiotic discovery and development. And therefore, the FDA approved one of their new antibiotics in 2014, Silvestro. What is Silvestro? Silvestro is an antibiotic that is indicated for the treatment of adults with acute bacterial skin and skin structure infections. This medication is taken both orally or IV. It's a once-a-day treatment for 6 days. But an interesting point, Cubist decided drug resistance was important enough that they list the following deterrent. Prescribing Silvestro in the absence of a proven or strongly suspected bacterial infection or prophylactic indication is unlikely to provide benefit to the patient and increase the risk of the development of drug-resistant bacteria. Inappropriate overuse of antibiotics leads to resistance with profound ramifications. So some things also warrant serious consideration. Now let's get back to the original reason for this piece, which is why the article failed to ask physicians for an honest answer in determining their treatment choices. Sometimes it can be the elephant in the room, which is the physician's perceived fear of a lawsuit. In asking that question or that answer, one opens Pandora's box. Have physicians relegated their control over to attorneys in what is known as obedience of authority? Examples of this form of control are clearly demonstrated in Milgram experiments. So this is known as an agentic state theory. And this theory notes that the essence of obedience consists in the fact that a person comes to view themselves as the instrument for carrying out another person's wishes, and they therefore no longer see themselves as responsible for their actions. So once this critical shift of viewpoint has occurred, all essential features of obedience follow. Okay, here's the difficult part. If physicians are proceeding along the path that they feel they have no control or choice, then are they acting according to the directions of a litigious authority figure? And are they doing just as they're told to do? Because if the authority is for the people, who are the physicians for?